Good afternoon, everybody. This is Dr. Burton here, coming to you from beautiful sunny Florida, and today we're talking about what to expect following breast augmentation surgery. As you know, breast augmentation surgery is an operation that we do under general anesthesia. It takes anywhere from 45 minutes to an hour to do, and what we do, we make a small incision, we create a space usually under the chest wall muscle, the pectoralis major muscle, and we insert an implant. This implant can be either saline or gel filled. Following the operation, you'll spend another 45 minutes to an hour with us in recovery, and then you'll be discharged home. I like to wrap my patients in a snug ACE wrap following the operation. You're going to keep this bandage in place for the first 24 to 48 hours following the operation. After that, you're going to return to the office. We're going to remove this ACE wrap, and we're going to examine your breast, and we're going to change the inner bandage. I want you to leave everything in place. Do not remove the bandage. Do not peek at the incision. Just leave everything alone until you come back into the office. We're going to take the ACE wrap off. We're going to look at the incision, we're going to clean the incision, and we're going to replace it, and we're also going to place you in a postoperative bra. In some patients, we're going to place a super mammary strap. A super mammary strap is simply an elastic band that goes over the upper part of the chest wall to push the implants down. When you first look at yourself following the operation, you're going to see a lot of swelling over the upper chest. It's going to look like the implants are sitting really high. You might have some bruising around the implants as well. Don't worry, this is normal. This is what we usually see following the operation. With time, those implants will move down, they will shift downward, the bruising will resolve, and the moderate edema that you might have following the operation will resolve also. This can take anywhere from several weeks to several months. So don't be alarmed by the superior displacement of the implants. This is normal. You're going to see this bulge here and you're going to feel super tight, but that's going to get better with time. Following the operation, I'm going to send you home with 3 medications. I'm going to send you home with a prescription pain medication. I'm going to send you home with something for nausea and vomiting, and an oral antibiotic. Of the 3 medications, the only one I ask you to take is the oral antibiotic. The prescription pain medication is optional. You can take the prescription pain medication, you can take Tylenol, Motrin, or nothing at all. I send the patients home with the medications because it's better to have it and not need it than need it and not have it. After several days to a week, if you don't need the pain medication or the nausea and vomiting medication, simply crush it up and dispose of it in the trash. Following the operation, you can resume a regular diet. The night of surgery, I suggest doing something bland and mechanically soft, rice, cereal, toast, oatmeal, things like that. But day 1, you can resume a regular diet. I want you to get up and walk around as much as you can. I'm going to send you home with the compression stockings in place. Keep these stockings in place for 2 weeks following the operation until you're walking like you normally would. But otherwise, keep the stockings in place. As far as returning to the gym and exercising, I want you up walking around, but I don't want you to do any strenuous heavy lifting until you're 5 weeks out from the operation. This is because with the exercise, your heart rate is going to increase, your blood pressure is going to increase, and in the early postoperative period, you're at risk for forming a hematoma or bleeding around the implants. So I don't want any strenuous activity. I don't want you to do any heavy lifting for the first 5 weeks following the operation. It's okay to shower 2 to 3 days following the operation, and when you shower, simply blot soap onto your body, let the shower water rinse off and pat dry, and then go back into your postoperative bra. Don't sit in a tub or use a public pool until you get an okay from our office, which is usually going to be 4 to 6 weeks following the operation. Following the operation, do not expose your breast scar to direct sunlight. Direct sunlight can cause redness and even prolonged darkness of the incision itself. So always shield the incision from direct sunlight. Usually the breast incision will heal as a fine, thin line scar, but some ladies will form a widened, thickened scar. If you notice any widening or thickening of your scar, alert your surgeon right away because there's some things we can do to minimize the scar. One thing we can do to minimize scarring is to put you in a silicone sheet and to apply pressure to the scar itself. So you see, a breast augmentation operation is fairly predictable with usually a fairly smooth postoperative recovery period. I hope I answered all your questions today about what to expect following the breast augmentation procedure. If you have any questions, feel free to leave a comment below. And if you're ready to move forward with the breast augmentation operation, give me a call. We'll discuss your goals and your desires.